name is Ernest Smith, and I am an active member of the Community Health Initiative, and I serve as one of the co-chairmen for the Methods Committee, as well as I am also actively engaged in my community as the co-chairman for what is known as the Monument McElderry Fayette Revitalization Plan, which is a revitalization plan that covers a 40 square block area east of the Johns Hopkins area. And what I'm here to talk with you all about today is a dynamic, organic process of data collection and problem solving. And that is the Community Health Initiative. Figure out which way we're going. Okay. Just a little background about the initiative. The Community Health Initiative is a collaborative effort to engage East Baltimore residents, community groups, city officials, Johns Hopkins, and a number of other organizations in an intense process of planning and critical thinking about how best to develop a health assessment for East Baltimore. However, as we look at this, we do recognize that the most important thing about our assessment and about everything that we're doing is the people of East Baltimore. And so our focus is on 5 zip code areas. They are 21205, 21202, 21213, 21224, and 21231. Now, who are we? We're known as the overall group that is overseeing this entire process is known as the All Partners. And this group is composed of stakeholders from Johns Hopkins, the community, groups such as neighborhood associations, churches, nonprofits, community members, and also residents of the areas. And information is taken out to planning teams, which reviews this information and develops strategies upon which is brought back to the All Partners team for their decision making. And as you know, there are six planning teams, the methods team, of which I am a part, and then we also have a human resource team, which I will speak about a little bit later on. Getting started. As you have seen today, we're talking about being here, we're talking about information that has been available, and one of the things that we recognize is that there was quite a bit of information that is available out here in the public arena. And so what has happened is a research assistant was hired to speak with community residents, community leaders, as well as faculty at Johns Hopkins. Data was obtained from the various sources that are available, and then that data has begun to be mapped. As you see, there's a listing of several of the sources of that data, Beania being one, the U.S. Census, Baltimore City Health Department, Baltimore City Planning, and here is a map. Based upon the data that has been collected, here is a map of some of the data that has been collected. This is a map of asthma, children who have been hospitalized from 2000 to 2009 for asthma-related causes. And one of the things, and our area is this area right here with the blue outline on it. If you will note that area, those are the 5 zip codes. And one of the things that we're able to determine from this is the changes that have occurred over that period in terms of children who are being hospitalized for asthma. And one of the things that we noted as we looked at this map is that in a number of those areas, hospitalization has gone down. But one of the things we also noted is that in 3 of our areas, the 3 largest areas, it has gone up, and it has gone up substantially, including one area here where we had a 15% increase. And just in case anyone is interested, that is also an area that actually surrounds Johns Hopkins itself. So this is information that is important to the group because now we are able to look at those areas and decide where we want to begin to target and to employ resources that would best be able to help those communities that are present there. Now, the question is, why gather this information? As I have pointed out, it helps us to understand what is the information that is available. Also, we begin to look at what are the gaps that exist, because there are so many members of the All Partners that are interested in health across East Baltimore that we need to know, okay, so what information is out there, you know, what information do we need, and then this information can be used to help us determine what information it is that we will need to get. And from that, a report can be generated with the intent of creating a baseline, helping us to generate a baseline of information upon which we can begin to assess future data as it is being collected. And at this point, as we look at this future data, we are now beginning to look at what are the things that we want to do. So the first thing that we looked at is an asset mapping. And by definition, many of the All Partners said, well, asset maps have been done numerous times. There's so many asset maps out there. However, as we began to undergo, as you will note, we underwent a training exercise in August of last year where we began to learn something new about asset mapping. And from that, the methods team, using the information from our training session, the methods team began to draft a talking guide that would be used to develop for the asset mapping process. And the All Partners began to evaluate those drafts of this talking guide. And finally, in February of 2012, a talking guide was presented and approved by the All Partners. As you will see, the main points, the asset categories that we're looking at will being covered in this asset mapping deals with physical community assets, volunteer groups, paid groups, economic assets. And then there's 3 additional categories, which I'd like to ask everyone to think about just for a moment. Individual assets, community stories, communication. Earlier today, there was a conversation about the fact that there are so many communities where people do not have access to the internet. As anyone here who has been involved in community development knows, you can send out the flyers, but the responses are generally low. So how is information being communicated across across the various communities in Baltimore City? And that is one of the things we also wanted to look at, because we saw that as an asset. And to prepare for our conversation with the people of East Baltimore, we thought about about the personnel. And one of the things that we thought about is that within those 5 zip code areas, there are communities where unemployment is high. Depending upon who you listen to, we can listen to the national stats and they tell us 8%. We listen at another stat and they'll say, well, after you involve those who don't get unemployment benefits, the number goes up to maybe 16, 17%. Well, as someone who has been involved in these communities, I can tell you that the unemployment rate in a number of these communities is actually in excess of 30%. And so one of the things that the All Partners recommended is that hiring be done of personnel in those zip code areas. We would, so that we are beginning to make an impact and say that, yes, we're here to benefit, that this process is about these communities and benefiting those that are in the communities. The next thing is an organization has been hired. And that group is Civic Works. It is a community-based organization, which many of the community partners recommended. And so a discussion was had with them, and they have been hired. And all of the personnel, because one of the things that must happen, and too often doesn't happen, is we'll hire people from communities, send them out there, no training. Well, they will undergo a 40-hour training. They must undergo a 40-hour training, which will also include, as part of their training, an in-field training and evaluation. So that means that they're going to get to come out and talk to people like me. And I get to tell them, hey, this is where you need to, after generating this talking guide, then tell them, here's the problem with the talking guide and talking to me. So it allows us an opportunity to not only help to build capacity within those that are being hired, but it also helps us to look at the methods in which we're doing our asset mapping. The next thing is, here are the 7 categories, and what we have beside us is a map from Beanie. This is an asset map of what is known as the East Baltimore Development, Inc., or the area known as the East Baltimore Biotech area. One of the things that you will note, and excuse me, I must cross to the other side, is that many of the assets that are being looked at within this map are generally your physical community assets, volunteer groups, paid groups, and economic assets. Those are the assets that generally are looked at. But the other thing, the most important assets are not being listed here. The individuals that live in those communities. The stories, because most of those stories represent the history of the communities that are within those zip codes. And as we all know, the histories of these communities is also an asset. One of the things that we heard earlier today as part of the opening session was that the history of these communities is also an asset. And then finally, we spoke of communication. How do people actually get information in their communities? The interesting thing is that most of the people, many of the people in my community will talk with me. I'm one person, yet by definition, I will reach out and I can get more information out to probably about 100, I will get information to about 150 people who will literally create it through a network, get information across the entire community faster than you could get a flyer out. So those are the things we need to know. Where are these people at? Who are they? Can we help to use them to help to improve the health of people in East Baltimore? And then the next thing is, as we look at all of this, we want to bring it all together. Bringing it all together means that here is the previous map, but I would like to ask everyone to just for a moment, just expand this area here and think of it as the first map. And I believe Erica actually spoke of how they can utilize zip code maps. And so if you take a zip code, we just want to take all of the zip codes and just use those as our base map, and then take data such as the asset mapping and take that information and then lay that on and begin to create these layers, so that our goal in terms of these layers, in terms of these maps, is to create a full complement of assets that will show materials, social, cultural, and political assets, as well as connections that exist within these 5 zip codes of historic East Baltimore. Now, what is it that we're striving for? What is the ultimate goal of all of this? Well, the ultimate goal, just as anyone else, is to facilitate the linkages amongst the communities of East Baltimore, which includes Johns Hopkins community, in order to take action to improve the health and the aspects of health and the determinants. And then the second part is to create a sustainable process by which we can now begin to take action to using that data to solve problems. And this is just a list of who we are. A few of the individuals that are involved: Baltimore City Health Department, the Johns Hopkins Medical Institution, the McElderry Park Community Association, the Monument McElderry Fair Revitalization Plan. As you can see, the list is extensive. But one of the things I'd like to say to all of you is that there is room for you as well. Please come join us. And our next All Partners, and in this presentation is our next All Partners meeting. And if you'd like to get more information, please contact Ms. Amy Gawad. Her email is listed here, as well as her phone number. Thank you.
Thank you to all of our speakers, and we heard a lot of great information about, the work that's being done in Baltimore and the Central Maryland area. So now we can go into the question and answer section. Our speakers, I don't know if you're comfortable staying where you are, and I'll kind of shoot questions, or if you prefer to come up. Come up. Any questions? Jim.
My question, I'm sorry. My question pertains to the policies and planning and so forth that happens to communities externally that results in the sorts of maps that we see. For example, I was looking at the first map that you showed and the health statistics of the community where I am, and I know that there is an overabundance of homeless shelters or homes for people who are affected or infected with HIV and AIDS, for homeless veterans, for, you know, the kinds of people whose life expectancy would be short and whose health situation, whose personal health would be low, all right? And those people are being concentrated, you know, based on the fact that there's funding to do this sort of thing in this area. There's funding for this in this area. There, Section 8 housing certificates are available for absentee landlords if they locate in this area, and there's funding and so forth. And so we wind up with these concentrations of people in communities that prevents them from growing and being healthy and so forth. And I know that there's supposed to be a move afoot to deconcentrate poverty, you know, because ultimately, no matter what all the issues are that poor people have, we're talking about circumstances of people with low incomes. And I'm wondering, how do we manipulate the situation, the policymakers, the planners, and so forth, to get them to stop creating this? So, you know, how do we present the data to demonstrate to them, if you continue to do it this way, this is going to be the result? I think we all know that, but somehow it's not hitting home and there's no activity being taken. What seems to happen is the issue is created and then the burden is placed on the stakeholders in each community to solve these problems. And you know, if you're dealing with Hopkins, for example, and my neighborhood is right around the health department, and those two places have the most red on the map. You see what I'm saying? So how do we look at this and use the data, or somehow, you know, brainstorm or strategically plan to change the map?
All right, and I'll throw in one other thing that I am involved in. I actually am a member of the Zoning Advisory Committee for Transform Baltimore, which is doing the rewriting of the Baltimore City Zoning Code. And one of the things that has come up, and one of my greatest arguments, has been around that issue. Because in the area where I am, and I mentioned that I was part of a revitalization plan, it does happen pretty frequently. In the areas of lowest income is where you will find the greatest concentration of HIV or the transition housing, things of that nature. And one of the things that this process will be able to help us to do, along with the efforts in the communities, is that it will allow us to now be able to see it, and be able to quantify that data. Because it's interesting, everyone knows it exists. I will say this to you, many people know it exists. I've said it through numerous, people know it exists. The problem is that it has not been fully quantified in terms of where it exists. Do you understand what I'm saying? And that even within those low-income communities, there's actually certain areas within those communities where it then rests. And so one of the things that this will allow us to do is be able to see, through this process that we're doing, be able to actually see where they're located and as a result of it, now we can begin to move towards public policy. Now you can affect that public policy changes that will help to benefit those individuals, because it's interesting, if you're right, that when they go into a low-income area, an area that is impoverished, where they need help, and you're putting in individuals that also need help, how do you expect them to survive? And so those are the type of things that we're looking at, and it's not so much Johns Hopkins, but now it's really an effort of all of the community-based groups utilizing, really utilizing Hopkins because of their influence, because they are partner, allowing their influence to guide us.
Any other questions?
To the first speaker, I noticed when you had your 5 areas, homicide, HIV.
The 5 leading causes of premature death.
Yes, I noticed in your strategies, in your report, you had 10 categories, but nothing in there alluding to the areas of violence prevention, considering that homicide was the 3rd highest. Everything was so nebulous and 50,000 feet high. To only deal with the problem, it needs to be very specifically so we can make it measurable. I'm just curious, was that something that you think will...
Well, so Healthy Baltimore 2015 is a policy agenda, which is separate than the work done for the neighborhood health profiles, which was detailed at the community level. So that is the, 50,000 foot level approach. But that actually used the data, because when you're talking about creating health promoting neighborhoods, you're looking at the environment, you're looking at violence, you're looking at, so even though it's not clear when you have those big titles of those 10 areas, those details fit in within those 10 priority areas. But the health department has specific strategies or specific programs, so we have a very well recognized program around youth violence prevention. So it's in the schools, it's in different community centers. So there's a lot of work going on that I was doing a very quick snapshot that wasn't actually presented.
Thank you.
A question for both Ernest and Mina. How much overlap or sort of synergy is there between the neighborhood health initiative from the health department and the community health initiative in Baltimore? Because it sounds like the neighborhood health initiative is a capacity building initiative trying to get neighborhoods involved in taking action on identifying issues versus what the community health initiative seems to do or is doing.
So, so Dr. Leaf has attended a lot of our neighborhood health initiative meetings, and Healthy Baltimore 2015, that policy agenda has actually been folded into the work that's being done through Hopkins. So it wasn't that it was developed together, but that the work is complementary and is integrated whenever possible.
And as Mina has pointed out, we are utilizing a lot of that up top level data, and now it's being pulled down to the neighborhood level where it now becomes specific to a specific community. And now it can, and thereby being able to have a impacts on specific communities, because one of the things that has been noted is that something over in one community will change as you move to another community, and now we're able to see that on a community level, and instead of trying to chase down everything globally, we're able to now deal with it on a community level as needed.
I want to follow up on the gentleman's question to my left. Can you, and it's to Amina, can you cite the name of the youth violence prevention program that you referenced in your response?
At Baltimore City Health Department, we have an Office of Youth Violence Prevention, and Layla Lehman is the director of that office.
Thank you.
And I don't know the details of all the various types of programs, but for example, Dating Matters is a program for middle school and high school, I believe. So that's just an example. So that office has a lot of different projects.
Thank you.
Sure.
First of all, thanks. I have a comment and a question. In the future. The question is how can I access the data? Who does that? And then the comment is on the website and the methods and
Sure. So through the website, with the download data and maps section, there's actually a food desert layer is one of the data sets you can download. But it's, of course, like I said, in a shapefile or Excel format, and if that's difficult to work with, you just contact us. We can, we've been working towards this goal of putting everything on the website, but up till now, people have just been contacting us individually. We work with them to get what you need. And thanks for letting me know. I figured something of course, the week you relaunch your website, there's always some major malfunction, so thanks. We'll fix that.
I think you mentioned that you're mapping food distribution centers and food processing centers. What's the timetable for that, and what's your thinking behind doing that mapping? Are you thinking about tying into local employment or other kinds of things?
Ultimately, yes. So we're kind of at the point where we're cleaning and coding the data. We've collected it all. And I hope that this fall, maybe September, October, that we will release that. And part of what's taking so long is it's statewide, not just Baltimore City. And, you know, our project goal is always to be a resource, and we are encouraging different groups who can use the data to take it and do good things with it. We don't always have the capacity within the center to do more, but I'd love to. You know, sometimes we'll do example maps to encourage certain ideas, and I think, you know, looking at job creation through food processing, and we also, because it's a food system map, we're looking at how much food is processed throughout the state that's not sourced locally, and how could.
Something we're interested in.
I was wondering if you collected information on restaurants and the location of restaurants and other prepared foods, and how that might play a role in the definition. Or how does it work with defining a food desert and defining a food swamp, I guess, and cost of, I guess, the basic menu item?
We do now have restaurants are included, and we've coded them a sit-down, full-service, fast food chain or carry-out. There are, you know, the majority of restaurants in Baltimore City. I would say the majority, but there are a lot of carryouts that are, independently owned, and we discussed with the city about including that in the food desert definition, and kind of wanted to, but other people who've done these analyses look at food that you prepare yourself, and so we haven't, it hasn't really been teased out how to include a prepared food source versus, say, a grocery source where you're buying foods that you take home and prepare.
It just seems that the emphasis in a lot of areas is to let's get another restaurant going to generate revenue for the neighborhood, but that's not really. People still, there's a disparity in the sense that you don't have the money to buy a prepared food item, but then you don't have a supermarket. So
true, and I do think also there's
so access is strangely defined there.
There's a lot of discussion on that. A meal at McDonald's is cheaper or more calorie dense than going to the store and getting similar foods and fruits and vegetables. And so I know people are making those choices on a day-to-day basis of getting the prepared food. And the other issue is, do they have, the resources at home to cook foods? And so it's just a much more complex issue to include the prepared food piece, but we're hoping to continue exploring it.
Another facet of that problem is that home economics has been taken out of many of our schools, and a lot of people don't know how to follow a recipe. A lot of the people that we're trying to help don't know fractions. So if it says 1/8 of a teaspoon or something like that, that goes by them, like some of the computer language does by others of us. But the concepts of mixing and blending and baking and there's a whole language that defines steps that you do to prepare food, and that's missing from the repertoire of many of the heads of households and others. And so what we find then is that they do what grandma did, or they do, and some of our grandmothers are quite young now, so grandma may have grown up on McDonald's, You know, you see what I mean? And so there's a conundrum with this lack of knowledge that centers around food preparation that handicaps people because they don't know how to take an item from its fresh state, even from a farmer's market. If it's available, you see an eggplant, they don't know what it is, they don't know how to make eggplant parmesan, you know, they don't know how it's going to taste when they get done, and they're not going to use their SNAP card to buy something that they don't know what to do with. And so that's another piece of the puzzle that I think we need to look at, because otherwise, if you look at all of the years that USDA has provided child nutrition programs and where we are now, if that was the solution, simply to sit a kid down to a well-planned or whatever meal, then we wouldn't have the health problems that we have. That doesn't get it. What has happened is that we've modified the meal to suit what the kid is willing to eat because we don't want to see food waste. So, you know, we need to address how to get back to where we used to be before. What is that? Hamburger helper?
I just want to add to that. It's a really important point, and you know, while you do want to, you need to make the options accessible. It has to be coupled with education and outreach, and we're hoping to try to also track, you know, where there are nutrition education courses or cooking classes, and make that part of the map too, to kind of see where we need more of those resources.
And I think piggyback on your comment, having the time to sit down and follow a recipe and to be in your kitchen for an hour is definitely a privilege. And I feel like a lot of people that are especially low income, they might be working 2 jobs. They're not going to have the time in between your shifts to say, okay, I want to make lasagna from scratch. You know, they're going to want to relax, and I think that it's a privilege of having the time and the motivation to say, I want to start making these positive choices in my life. So I think you also have to take into consideration, in some regards, you know, the socioeconomic status of people that just might not want to spend an hour of their day cooking.
Right. And I just wanted to add one more comment on that, in that one of the things that we also have to look at, and I understand your comment about the socioeconomic status, but one of the other things that will kind of tie all of these together is we also have to look at policy decisions. Because you know, when I was younger, the way I learned to cook is I learned to cook at home, but I also learned to cook in school. One of the things that they taught us in school is that we got that education, which seems to be a key here, having that education component. So that, and my mother, and as I grew up, my mother was sick, so I had the benefit of being able to prepare food and help my family to be able to do those things at a very young age. Whereas that does not exist today. So, but it was a part of policy in terms of how the kids were educated. So we need to also think about what is the impact of policy also on whether or not, what types of restaurants come to areas, how our kids are educated in the schools, how we can move some of these things that you all are learning forward so that it will begin to benefit the families and also change the health of a number of families throughout Baltimore City, as well as maybe the region.
We'll take our last, excuse me, last question.
I thought that was a really good point, because it occurred to me when she made that comment that we as a culture have accepted an educational system in this country that doesn't teach its children how to cook, because, I don't know, isn't that girls' work or something like that? And the other thing that the educational system has dropped is recess. That for some strange reason, this seems to be a huge problem in the educational system to bring back recess at a time when the federal government, the state government, and our local health department is saying, we need to have more physical activity every day. And the education system is scratching its head about how do we get the kids outside every day for 10 minutes? I mean, is this just me? Am I the only person who thinks that this is an odd way to handle something that was normal when I was a kid, when you were a kid.
Yeah,
And I
exactly.
thank you for your point.
We're taking vocational education out of the schools as well, and so now if you can't pay for vocational education, you know, to go to tests, college, or whatever, you don't have those job skills to leave high school with. And those people make good money. You know, if you try to hire a plumber or an electrician, you know, I don't care how much money you make, it's gonna take a bite out of your pocketbook. And we've eliminated that from the reach of many of the families that we're trying to help.
Well, thank you to all of you for your time and attention and your wonderful questions. Please join me in thanking our speakers. I believe lunch is next on the agenda, and it's downstairs in the atrium where you enjoyed breakfast. Thank you all again.
Oh, and one more note before everyone leaves. We're going to be posting presentations